Okay, so this is your video on serology kits. So I've laid out here for you the majority of the serology kits that I will be performing via video for you here in my garage laboratory, which I have now fondly started calling the Graboratory. And so serology kits are basically simple. Most of the kits sitting here are waived tests. And if you remember from Intro to MLT, a waived test is something that somebody can be trained on the job to perform in a doctor's office, like a medical assistant or a nurse or the doctors themselves could do the majority of these kits. So waived kits include something like the SureView pregnancy test. So if you open the kit, it's just a bunch of packets. And you can see here that you can use serum or urine to test for HCG to see if a person is pregnant. Inside of the kit, there's a simple little cartridge and a little dropper. And you take some sample and you put the sample in the hole and you wait and you look for a result. So these are pretty easy to use. And most of them can be used by almost anyone. Others of these tests are moderate complexity. So if you look at this HIV test that's put out by ChemBio, if you're using whole blood from a finger stick, it's a waived test. But if you are performing this test on serum or plasma, you're going to have to actually prepare the sample through more detailed steps, and it's a more detailed sample collection, so it's not a waived test anymore. And again, it has a packet that has the cartridge inside of it. This is the color slide mononucleosis test made by Remmel. I'm using that one. A CLIA waived influenza A and B cartridge test that I actually did perform on myself this weekend because my kid had a fever for 2 days and then I got a fever. So I was like, what the heck do I have? It did not come up positive. However, I did do the test on myself. This is the strep test. This is the one that if you've ever gone to the doctor and they want to know if you have strep throat or to see if they need to send a culture to look for strep throat, they will take a sterile swab that's included in this kit and they stick it in the back of your throat and make you gag, and then they can perform this test. And this is a waived test that the nurses will do in your doctor's office. Other kits, however, are a little more complicated, more detailed. And those are the kits that I've opened here in the front and pulled out the reagents for. So just like in the dilutions card that I showed you how to make dilutions to do a titer in serology, there will be a card included with these more detailed kits. And so you can actually perform quality control, positive and negative, and then for other patients on the card for this test. This test is known as anti-streptolysin O. We will talk about it soon, and I will be performing it for you soon, but this is a more specific test to find out whether or not a person has strep. You see that reagents do come with this test. There are particles that will show us agglutination, and these are our controls, positive and negative. We also have small droppers that have a stir bar on the other end of them. I will be showing you how to use those, and those are always included in the kits. RPR is another kit that's made by the company ASI, and you can see here that there are more circles on the card that they provide for you. There are actually 3 levels of control for this one, and this one you have to use a reagent that actually contains charcoal particles, because this is a precipitation reaction rather than an agglutination reaction. So we'll be covering that one shortly. It also has its own droppers and stir bars. One of the other kits that we will be performing first, rheumatoid factor to look for rheumatoid arthritis. This one is made by StanBio. And C-reactive protein, also made by StanBio. And again, it has reagents and reaction cards and droppers and stir bars in it. However, the other thing that I wanted to show you that is included in every one of these kits is called a package insert. So a package insert has all of the information you need to know, and this one is front and back. Others are multiple pages, and it has everything you need to know about that test itself. So please move on to the next video called Reading Your Package Insert, so that you can understand how to look through these package inserts before you watch the videos that show me performing the tests.